Hi, I'm Diane. I just want to start a series of videos talking about my journey with going through a cervical fusion surgery. It's a laminectomy, and I'm getting done from the back, the posterior side, the back of my neck. Seems like a lot of the people who had the ACDF surgery, the anterior, where they're going in through the front of the neck, post a lot of videos, and I don't see a whole lot from this side of things, so I thought I would just start documenting my journey, hoping that it could be helpful for anybody else who's gone through this process too. I am having surgery to fuse level C4 through C7. It's down near the bottom of my neck, those 4 vertebrae. My situation is that I was apparently born with fairly narrow vertebrae, and I turned 50 this year, and that seemed to be the year that they decided to go off the reservation and started really compressing my spinal cord, which caused some issues that it's only been in the last month and a half or so that I knew it was actually spine related. It started out, my symptoms really were very strong in my hands for a number of months. A lot of tingling, a lot of numbness, lots of stopping being able what I would normally do. I'm a piano player. In the last few months, I've hardly been able to play at all, and that's really been just kind of decreasing as time goes on with that. I'm a writer and I'm in public relations, so typing has been very difficult. So I was focusing on trying to get that fixed when some of the other symptoms started building too, that I started really having a lot of balance issues, gait issues, kind of stumbling, starting to really fall a fair amount here in the last few weeks. All that putting together shows that certainly there was something bigger at play. And so I've been diagnosed with spinal stenosis, with being the narrowing of the narrow vertebrae, with myelopathy, which means that's the compression of the spinal cord and all the nerve issues that go along with that. So surgery really does seem to be my only choice. And I'm fine with that. If that's going to set things in motion to get the healing started on the other side of it, then let's get her done. I first talked with a orthopedic surgeon about the process because I was focusing on my hands at that point, and then it switched to another gentleman in that practice who decided to get an MRI, and it was very clear what the problem was at that point with how things were going with my spinal cord. So he recommended the ACDF surgery. I did some research on that, looked into that, decided I wanted to get a second opinion, as I think anybody in our process probably should, and researched and found a very qualified neurosurgeon in my area, and talked with him. And in his assessment of how things were in my situation, he recommended that I go with the posterior surgery. I think mainly for the fact that it would have more safety in the long run, that I wouldn't have to go back and do this again should I have any more vertebrae in the area start to join the party and go off the reservation as well. I am absolutely certain that everybody's situation is different, and that the lead up to the surgery decisions are different, and the outcome of things are different. And so this is my particular situation. Another thing about my particular situation is clearly you can see I'm in a collar at the moment. It's an Aspen collar. I don't think everybody who is leading up to surgery gets to enjoy one of these, but that's been my situation in the last few days specifically. I've kind of really struggled with a lot of balance things, and so the doctor said that at this point it was best for me to have that, and I'm assuming that I'll be wearing this a fair amount after the surgery as well. Not everybody has these things. So, as we watch these videos, we just all have to keep in mind that everybody's situation is different. Everyone's going to have different nuances. So my surgery is tomorrow. I'm told that I need to prepare for probably about 4 days in the hospital. I don't know, that's the norm for everybody. But I'll have a fair amount of time to just recover there, deal with the pain medication, going off the anesthesia, all these sorts of things. And I think for the fact that I'm getting 4 levels done, that must be part of the reason that I'm staying a little longer. Not sure, but I am, everybody has a fair level of anxiety with these situations. And I will be anxious to be on the other side of the surgery. I will say that, but I feel prepared. I think I have my head as well as I can to go into it. And more importantly, I'm a woman of strong faith, and I am just trusting the Lord to be with me in this process, and for all these unknowns, that He's just going to be carrying me through this to the other side, that I can start the healing on the other end of this. So some practicals about what to think about for taking to the hospital. I think it seems likely that the whole being able to raise my hands and arms and so forth after the surgery is going to be pretty limited. So I think it's a good idea to be having shirts that open from the front to be able to take. I've learned just from another surgery I have going to the hospital and so forth, it's good just to wear something like athletic sandals with socks. I know it's not the best fashion statement, but hey, and just things that you can easily get your feet into without having to worry about putting actual shoes on. So that will be what I wear to the hospital, and some sweatpants. And as soon as I can bust out of the hospital gown and not have to be just in that, I'll be very ready to put on pajama pants, the shirt that opens from the front, all that kind of stuff too. So, and then, just all the normal stuff that you would just have to be able to pass some time. Chargers for any electronics that you take, maybe a book. I'm sure I'm going to be on a lot of pain medicine. I'm probably just staring off in space, but I'll take a book. I think it's good that you just don't take 1,000 things to the hospital. Most of the things you are really going to need there are certainly going to be provided for you, and you don't want to have to worry about valuables and just stuff that is more than what you really want to worry about in that point in time. So I think the goal of going to the hospital is less is better, and just do your job there of laying around and really letting the healing process start so you can get home and having that healing process continue from there. So I'll be continuing these, documenting how my process goes, what I'm experiencing, what I'm learning, and hopefully this can be of benefit for you. So